Hello, my name is John S. Williams Sr. I'm an 80-year-old African American male, and I've been living with prostate cancer for 20 years. Recently, I learned of a young man who was diagnosed with prostate cancer and was somewhat at a loss how to proceed. To be told you have prostate cancer is a scary thing. It was scary to me when I first heard it. That was 20 years ago. And I'm sure it's scary for anyone who's been told they just have it today. So I tried reaching out to the young man and try to allay any fears that he might have, which I'm sure he would have. And so with doing so, I thought, hey, there's got to be thousands of men, young and old, that have been told they have prostate cancer and realize that their life is going to be changed forever. So, in my humble way here, I'm making this video sharing my journey with prostate cancer in hopes that it might help someone navigate through their journey with prostate cancer. I will not be giving any medical advice. I'm not qualified to do that, and I won't be disparaging any doctors. And this is not a do as I did video. My only purpose here is to tell my story, and somewhere between the lines, there might be some helpful advice that might help someone who's ever viewing this video. So let's get started. My journey with prostate cancer officially began in 2001. I say officially because there was a lot of things that happened that led up to being officially diagnosed with prostate cancer. Sometimes around 1995, I started getting urine infections and some pain in my rectum. I made an appointment with my PC, primary care doctor, who prescribed an antibiotic for my infection. However, by the time my appointment rolled around, the pain in my rectum was gone, so I didn't mention it to the doctor. After taking the antibiotics, my infection cleared up. There was no more pain in my rectum, so I joyfully continued on with my life. However, the joy didn't last long. The urine infection was back, and so was the pain in my rectum. I went back to my PC doctor, and this time he recommended that I see a urologist. And he recommended one. Now, although I didn't know at the time seeing a urologist was the beginning of my journey that would lead to being diagnosed with prostate cancer. A urologist. I heard the name and the word before, and I certainly wasn't familiar with what they do. But I found out soon enough. A urologist treats diseases and conditions with the kidney, the bladder, the urinary tract, male reproductive systems, and the prostate, which is what we're talking about. So as quickly as I could, I made an appointment with the urologist that my PC doctor had recommended. Now, the first thing he did was order a urine and blood test to determine the best way to treat my urine infection, and the blood test was to measure my PSA. Now, there's a term that was completely foreign to me, PSA. I knew about a urine infection, treated with antibiotics, and it's gone. But I knew nothing about a PSA number, and this particular doctor didn't care to explain it to me. I was asked to make another appointment and get the results of the blood test. I went back to his office in 4 weeks, where I was told my PSA number was high. It was 6, and the normal range is 0 to 4. And while in his office, for the first time since boot camp, I was asked to submit to a digital rectal exam. Now, a digital rectal exam is a fancy way of saying the urologist inserts a lubricated gloved finger up your rectum and feels for the prostate to see if it may be enlarged, if it has lumps, nodules, or tender from prostatitis. Before I move on, I want to pause and explain what the letter PSA stands for, what prostatitis is, and explain something about the prostate. First, let's look at the PSA. What is it? A PSA is an abbreviation for prostate-specific antigen. It is a protein produced by cells that line the small glands inside the prostate. Now, I didn't see the need to understand the meaning of specific antigen. Just knowing that the letters PSA stood for was good enough for me. And knowing that when a man has a prostate cancer, his PSA level tends to rise, which is why the PSA test is used by physicians to screen for prostate cancer. Now that makes sense. Now what is prostatitis? Prostatitis is a bacteria infection in the prostate that can also raise the PSA levels. However, most times it does not lead to cancer. It is a benign ailment which can always be which is not always curable, but can always be treated with antibiotics. Now, let's look at what we're talking about, the prostate. Just what is it, where is it, and what is its function? Up until my first visit with the urologist, the word prostate simply never crossed my mind. So while I was in the doctor's office waiting to be seen, I checked out some articles on the side table next to me. And what I found out, the prostate is a walnut-sized gland located between the bladder and the penis. Now, the prostate sits just in front of the rectum. That's how the urologist can reach the prostate with his digital exam. I also found out about the urethra tube. It runs from the bladder through the center of the prostate, through the penis, letting urine flow out of the body. So, if the prostate is swollen, you can see where it contracts the urethra, and it's one reason for a weak urine stream. And I'm researching further, during ejaculation, the testicles introduce sperm into the urethra. Now, the sperm is carried through the prostate by the urethra. Remember I said the urethra runs through the prostate. And the prostate squeezes a fluid into the urethra, nourishing the sperm as it moves through the penis, helping to the reproductive system. So there you have it with PSA, prostatitis, and actually what the prostate does. Now, while I found out the information was useful about the prostate and its function, what I didn't know at the time, what I didn't understand was that every decision I made during my journey on the road with prostate cancer, I should have made as if my life depended on it. And I found out later it really did. Now, the doctor, when he said my PSA was high, he was not just talking about a number, it was my life he was talking about. The point I want to make here, and I will make in various points throughout the video, like the instructions given to a boxer, always keep your guard up at all times. The urologist that you choose in a perfect world should be a partner during your travel on the road with prostate cancer. He or she should have a treatment plan, and both the patient and the doctor should agree on every step. So you and the doctor should agree on every step of the way. If the doctor is unwilling to share treatment options with you, you find yourself another doctor, because it's very important that you have a doctor that's on your side. So at this point, as I mentioned, my PSA was 6, 2 points out of the normal range of 0 to 4. The urologist suggested that since prostate cancer is a slow-growing cancer, we should take the wait-and-see tactics, which a lot of urologists do with prostate cancer when it's just diagnosed. So come back to his office in 6 months and draw more blood for PSA reading. That's what he said. At the time, I was a fairly young man, had a great job, a wonderful family, really didn't feel bad, so wait and see sounded like a great idea. It was a beautiful day, and I was anxious to get out of the office and get back on with my life. Now, 6 months rolled around fairly quickly, I might add, and all the while I noticed a somewhat weaker urine stream, and frequent trips to the bathroom at night. Plus, the pain in my rectum would come back from time to time. I kept my appointment with the urologist. I gave another blood sample, and a few days waiting for the test results, I found that my PSA had gone to 8. So you remember the limit is 0 to 4. Now I'm up to 8. So at this stage, he prescribed a drug called Proscar. Proscar is used to shrink and enlarge prostate caused by prostatitis, as I mentioned earlier. It can also lower the PSA, which I also mentioned earlier. Why should I be taking Proscar as part of my journey? I didn't question the doctor's decision. The urologist was closed-mouthed about the reason. Trust me was his M.O. Come back and see me in 2 months. So I took the drug, and I returned in 2 months. Back in his office in 2 months, he took more urine and more blood to be tested, and I went through another digital rectal exam. Now, I left his office feeling a little violated with a card for a 2-week appointment printed on it. So 2 weeks later, I returned back to his office to get the test results. And again, there was no urine infection, just a little contamination, not enough to warrant an antibiotic. But despite taking that Proscar, that may have lowered my PSA was on the rise. It was now 11. So I'm way out of the range now of 0 to 4. So since my PSA continued to go up, the urologist determined that it was time for a biopsy. Now, I think we all know what a biopsy is. You take a sample of an area that's suspected of being cancerous, and you send it to the lab to see if it is. So I made an appointment for a biopsy. Now, this procedure was another turning point in my journey. 2 weeks later, I was back in the urologist's office. I had to have samples taken of my prostate to be biopsied. Now, at this point, it's worth noting just how the urologist took the samples. In one of his examination rooms, I was instructed to remove my pants and my underwear, put on an examination gown, and lay on my side on an examination table. The urologist, using his finger as a guide and using a long instrument with a pinching claw on the end, snapped 13 pieces of my prostate to be sent to a lab to test for cancer. The results of the sample was negative. However, blood tests showed that my PSA continued to rise. So now, what does the urologist suggest? Another biopsy. So in the morning 2 weeks later, he performed the second biopsy the same way that he did the first. And I can tell you, nipping at my prostate with that pincher claw was very unpleasant. Now, at the time, I was a young man, and much younger than I am now, and I was still working. So I left his office without any instructions how to take care of myself on what amounted to really minor surgery. So the second biopsy was done by noon, so I went back to work. I worked for a major communications company that required me to visit multiple offices. So I was very busy and not thinking about drinking water or how many times I was urinating. After work, when I got home, I couldn't urinate. What I found out, the second biopsy had caused a blood clot in my urethra, so I couldn't urinate. So I went back to the doctor's office that night to be catheterized, which meant placing a tube into my penis up past the prostate into my bladder to clear the blood clot and allow me to urinate freely. Now, that's not an unpleasant experience either, but it had to be done. So during the next visit, after the second biopsy showed no cancer, the urologist wanted to do a third biopsy. Now, that's when a caution signal went up in my head. Remember the warning I told you about boxers? Always keep your guard up. Are you getting the picture here? This doctor's treatment plan was sketchy at best and could prove dangerous as my cancer progressed. He talked at me and not to me. If your life, it's your life. It's your time to change doctors. That's it for this session. Next time I will discuss what happened with a new doctor. Thank you.